sorry, I'll let you start again.
All right, so my name is Beth Armstrong, and I'm here today to present to you guys our psychological safety. And it is to help enhance our employee engagement after obviously the pandemic. But we are going to actually talk today just about psychological safety, which is kind of our first pillar of improving our workplace culture. Just a little bit about me so you guys know. I've been in the veterinary field for over 20 years at this point. So I know I look young, but I've been in the field for a long time. I am the founder and owner of VTNE Prep. So if you guys are on social media, that is one of our groups. And then I also run the VTNE Prep crash course for people who are looking to need help passing their VTNE. So that's been around since the pandemic as well. So I as well work at Gateway, which is in our area Trusted Journey. So if you guys do any like cremation service with Trusted Journey, I am actually your territory manager in this area. So I really love helping with end of life service, especially when I worked in specialty medicine. I worked in emergency critical care and oncology. So that was pretty one of those big things that I really enjoyed was, specializing in that. So it just kind of seemed fitting to kind of go into there. So, but today we're going to talk about psychological safety, which, like I said, is the first pillar of a positive leadership, of changing our leadership. So we have talked a lot in the veterinary profession about how we really need better leadership, better culture and well-being within the profession, except we really haven't focused heavily on how we're going to fix that. So that's why today I wanted to at least start that conversation with how we're going to fix it. So the first aspect of it is psychological safety, and we can't really fix our workplace culture in a day or 2 days, or sometimes it's going to take a year. So the first thing that we really need to bring to focus is psychological safety and making sure that we have that within our practice. So again, that's why I really wanted to focus on this first, and then we can kind of focus on the next part afterwards. So having 15 minutes to focus on all four is going to be really hard. But whenever you talk about psychological safety, it means that we have the ability within wherever environment that we aren't going to feel like we're going to feel stupid or anything like that. We can be our authentic self wherever we are. So when we start talking a little bit more in depth here, I really want you guys to focus on how you feel at work, how you have felt maybe at school even. If you are a student, anything like that, like that's really important, is starting even as a student, is how we're making students feel, how we are making ourselves feel in practice, and remembering too that everyone is a leader. It does not matter if you have a leadership title behind you, that we can be leaders no matter what. So whenever we're talking about improving workplace culture, it has to be everyone involved. Okay. So yes, it starts at the leadership, but we have to all be a buy-in to that. So later we can always talk about purpose, path, and progress. And this actually comes from Flourish Veterinary Consulting. So I'll kind of talk about Flourish Veterinary Consulting at the end, because I love Josh Weissman and he has great stuff. But we're going to talk about psychological safety. So another part of what they talk about too is how do we work on well-being, right? So well-being is a really important thing. And there's been a lot of studies done of how can we actually have good well-being. And it has been studied that we can actually not have appropriate well-being without having a great workplace culture, without having that positive leadership at work. If you're working at a place that you just feel horrible going to every day, you're not going to be in a good well-being aspect within your life. So having that positive emotion, having engagement, having great relationships, meaning and achievement is going to be really hard for you to do. So that's where we need to start making that shift within our jobs to like really make some of those improvements. So just again, start thinking about how can we make these things better. I hear a lot of times people blame a lot of like client relationships and stuff like that, where that's the focus of where we are not having that great well-being or not having a great workplace culture, which again might be part of it, right? Like clients can be a little bit difficult at times, but that's not the overall majority of the issues that we've had. Like clients are always going to be, there's always going to be a difficult client, but there's something else at your practice that's probably making you not feel perfect or great within in your role. So we have to really dig deep and find out what that is. So psychological safety. So looking at this, so it's really the single most important characteristic of having a successful team. Okay, so we need to decrease our turnover. And decreasing turnover is huge. The veterinary profession has a horrible amount of turnover right now. And so if we can help with having great leadership, if we can help with having great psychological safety, a great purpose within our hospitals, then we'll have a great, decreased turnover. So looking at this turnover rate within your hospital, our goal is to have single digit turnover rates within our hospital. Okay. So single digit percentage turnover. So if I've actually worked for a corporation where our turnover rate was in the 40% turnover rates, that's really, really terrible. Okay. So we have had to look at how are we going to make that better in the future, right? So what was the issue? Okay. Number one was psychological safety. We had to make a change within that. We were terrified to go to work because we were afraid of making mistakes. We were afraid to talk. We were afraid to do anything. And so that is a huge part of psychological safety. So we have to make sure that if we ask questions that, it's okay if we ask a stupid question, right? People always say there's no stupid question. It's true. Like there really is no stupid question. We really don't want to make, something that is a stupid mistake, right? So it's important to ask any kind of question. We want to make sure that we're able to ask for feedback as well, so that we're not feeling like we're incompetent either. We want to feel like we're getting constructive criticism back too, right? So that things are not feeling like they're negative. But if we can get constructive feedback, that means that we're actually going to be able to improve, right? So there's ways that people can feel nice and there's ways of people that can feel kind. Like it's nice, people can say things that are nice, but if you can be kind to someone, being kind to someone doesn't mean that we're just getting, feedback like good job, but maybe there's a way that you can improve for better, right? Like that's kind feedback. Nice feedback is like good job, without anything else. Like we'd rather have some constructive feedback. So can you suggest innovative ideas without really feeling like you're disruptive, right? So I'm the type of person that I don't always kind of go along with the flow of things. Sometimes I go, that's not a bad idea, but like, what did you ever think of this too? And so sometimes people don't really like that, right? And it's not to say that my idea is better, but I'm kind of one of those, devil's advocate. And that's not a bad thing. We need to have people in our profession who go, well, what if this happens? Like let's kind of think of some different innovative ideas so that we can always be looking for, being a little bit better, being a little bit, above average, that let's try to work together to be a little bit better. So we want to also look at how can we stimulate work engagement, right? So not being able to just come to work, get our job done and go home. How can we really feel engaged? So for me, the fact that you guys are even here today shows that, hey, you know what? You're engaged with wanting to do more within your profession, right? You want to promote sharing knowledge to the environment. I am the type of person, and anybody that knows me is that I will share anything with anyone. I am the person that has all the different, like, articles, and I have all different things on my computer, and I'm willing to share any type of feedback that I have. Which sometimes to some people is a little too much, but I think that we have to be able to share any type of knowledge we might have. It's only going to make us better. And for me, I'm that type of person that I just love soaking it all up. And as someone who's been in the profession for over 20 years, that's what keeps me going. So we have to start looking at each other and going, okay, well, why are we wanting to leave after 5 to 7 years? Is it because we're keeping ourselves bored and complacent? And or are we just and we're blaming someone else? Or should we try a little bit harder on ourselves to say, you know what, maybe I need to like jump in and do a little bit extra CE that I'm really interested in. And then my leaders need to say, encourage me to do that CE that I really love to and promote that. And then we need to also show that positive impact within our job satisfaction. Okay, so utilizing that at work. So, some challenges that we have with psychological safety. So, unequal power distribution and status. So, there are some places that we use titles like crazy, right? We have to have this chain of command all the time, right? And you have to go through all these chains of commands. And I get chain of command and it's great sometimes, but you should be able to talk to anyone within the organization and feel like you're supported, right? So I actually work at an organization that I feel like I can talk to anyone and they're going to help me no matter what. I know who my boss is, 100%. I'll go to my boss anytime. But I can actually go and talk to the CEO if I really needed to, if I felt like I really needed like some extra support, or if I just had a question, he would totally be there. Or if I needed to talk to a different manager in a different territory, I would totally feel supported that way. And my boss would not be offended. And I think that that's really important, is that we feel supported no matter where we're going. That we also don't have these negative consequences for honest mistakes. I don't think that many people go to work intending to make mistakes, right? That we need to make sure that, hey, these are learning experiences for us. All right. So that we're not doing this whole blaming and shaming game. That's not good. That's not good for our workplace culture. We don't need to point the finger at people. We don't need to make them feel terrible for making honest mistakes. That we need to learn and grow from that. And then we need to also have leaders that consider opinions from other employees. We all have amazing brains and we need to be able to utilize these great opinions from everyone else. So having, workshops with all different people to come up with great ideas is really, really important. So what does you and your team do to make it safe for people to share their opinions and or disagreements? So does anyone have anything that at your places of work, do you guys have anything that you feel like that currently that you guys do that makes it safe for you guys to feel that you can do to share your opinions or disagreements? Sorry, I'm very interactive. Anyone? Or what steps could you guys actually take to make it safer? I'll pick on people. Amy,
Yes.
do you have anything at your hospital that you guys do currently that makes it safe to share your opinions or disagreements? Or what do you think are some steps you could do to make it safer?
So I don't work at a clinic
Okay.
currently.
Yeah.
So that's why I wasn't chiming in, but I
Ah,
used to work at a place that was taken over by corporate.
yeah.
It was, an independent place, and then they were taken over by corporate, and everyone kind of shut down. We had a big turnover rate at that point because people just, were kind of lost. These people were like in charge, and they were far away, and we couldn't talk to them. Like, we had to go through, like you said, chain of command, and it was just really difficult for a lot of people to do that. And
Yeah.
we lost a lot of people at that point.
Yeah. And that's interesting because actually Debbie and I were just kind of talking about that before everyone jumped on too, that, you know, not having someone right there, being able to talk to people,
Mm-hmm.
having a little bit more camaraderie amongst each other and really kind of knowing each other, having that connection can make it a lot harder, you know?
Yeah. And then if I could just say something else, like I
Yeah.
was head tech for quite a while, and um I was kind of thrown into the position.
Yeah.
Um, but I was told that I did a very good job, and they really missed me when I left. But the people that I had, I think we all felt really, really comfortable with. And then as people started leaving, it just all kind of unraveled and just was never the same.
Yeah. Yeah, most definitely. And you know, like as in the veterinary field, we all work so close together, like physically and mentally, we work so close together. So it just makes sense that we do need to make those connections as well. So as that head tech, that does make sense that you're going to have to, you know, tend to people's needs, not just as a boss per se, you know, to talk to them about what they're doing right and wrong, but also to kind of just check in on them.
Hmm.
And so I think that we do see that a little bit more if we have people that are a little bit more distance away, and we have to keep that in mind is, hey, you know what, even if you have bosses that are further away, we have to have each other's backs too. When, you know, just because you might not be someone's boss, that we have to have each other's backs and like check in with people. Hey, what's your idea on this? Or, you know, like I'm doing X, Y, and Z. What's your idea on how I should do this or whatever? Or how are you doing today? You know, or I've noticed that you've done a few euthanasias today. Are you okay? Would you rather me take this one? You know, so I think we have to get back to kind of checking in with people a little bit more and making people feel okay. Anybody else have anything they wanted to add? No, that's actually pretty good. Um, all right. So for the four components of psychological safety, it includes inclusion safety. So making people feel like they are part of the team, right? That they all have a seat at the table, which is huge. I also refer to it because I actually taught at a few different vet tech schools, is that we also have to have inclusion safety with our students. So that was really big for me when I taught in the classroom, was that, you know, as a teacher, we can't really be that much above those students, because even as a technician teacher, we're actually peers with those students at some point or another in the field. I go out and I see my students now, which is amazing to see, right? And they joke with me like how we're peers now. So we're a little bit different as teachers. My husband's a teacher, he's a high school teacher. And so they're not really peers for quite a while, right? Because, you know, he's old at this point, but, you know, it takes a while for a high school teacher to have those guys as peers, but we're peers. So when I was teaching vet tech school, you know, I sat down with those students. We came up with those classroom rules really together. And those classroom rules, they were my classroom rules too. I followed the same rules. And so we have to all feel like we're included together. That's why I have discussion-based learning as my thing for teaching, because it should be that everyone is included in that discussion. Learner safety has to be there. So again, it's okay that we make mistakes as we learn. I love teaching. I love taking people under my wing, even when I was in practice, because that is the only way that we're going to get better. That's the only way people are going to become amazing. I have people that I've even taught as doctors who are now like specialists and are medical directors. And to me, I feel like that is the most amazing thing to see, is that we have people that we have taken under our wing, we've taught little things to, we've done that. And that makes us so incredibly amazing. Contributor safety, again, that we feel safe to give our opinion on stuff. We should be able to sit down at a table and go, I think that's a bad idea. You know, if you have to always say yes to everyone because everybody else voted for the same thing and you feel like you have to, that's not okay. We have to be able to put our opinions out there and not feel like you're going to get in trouble. And then challenger safety, again, is part of that. Hey, I really don't think we should be doing that. Or, you know what? That person poked that animal 7 times. We need to stop doing that. We need to do something differently. Or, hey, that animal's getting really hyped up. I think you should give that one a break. Right? We have to be able to challenge those things and feel like it's going to be safe, feel like it's going to be all right. All right, sorry, I'm going a little crazy here. All right, so increasing that psychological safety. Okay, so we have to encourage collaboration and competition versus competition. Sorry, encourage collaboration versus competition, which can be hard. As you guys know, in the veterinary field, especially if you work in specialty, I feel like sometimes we have this competition that someone has to be the best, right? And for me, I always felt like, hey, we can all be the best technician out there. It's fine. Like, could you imagine having a hospital filled with the best technicians in the world? So why do we have to have one amazing technician and everybody else not that great? It just never made sense to me. So let's collaborate with each other and make each other amazing. You know, someone really loves animal behavior and someone really loves nutrition and somebody really loves, how to place central lines. Everybody teach each other those things and make each other great. Acknowledge. So acknowledge your own faults. Okay. Be proactive instead of reactive. And then also respond in an appreciative manner. Like thanking people means a lot. You know, when at the end of the day, when you've had a hard day or whatever, thank people. Be like, hey, you know what? Thanks for being here today. Thanks for helping me out. Thanks for cleaning up my mess. It means a lot. And then model curiosity. So asking questions is great. Hey, why did you, I'm just curious, why did you decide to do this instead of that? Why did you decide to do that procedure first instead of this one? And I think that that's really important sometimes, especially with our doctors as technicians, is that you start asking them questions of saying, I'm just curious why you wanted to do that. It starts, getting us to learn more from them, and they really want to teach us too. And then we start learning that active listening, and then we start pairing that with our doctors. So how do we build trust? So if anyone has ever read or listened to Brene Brown, okay, I like Brene Brown a lot because she's very direct and she speaks from her heart and she even writes from her heart. It's just great. But she talks about how we build trust. Okay. So this is really great, especially for any like new leader out there, anyone who wants to be in a leadership position. And I think I could have really benefited from this probably 10, 15 years ago. But setting boundaries, right? So we need to set clear boundaries and know like when things are okay and not okay and why. Tell people that. Being reliable, meaning you're going to do what you said you're going to do. Not just, hey, I'm working when I'm going to working, but if you're going to say you're going to do something, you're going to actually follow through and do it. Accountability, meaning, hey, if you make mistakes, it's great. Apologize, make amends and move on. All right. A vault is really important. And this is a big one, especially in the veterinary field, I feel like. If you have information and experiences, it's not, and they're told to you, it's not yours to share, right? It's somebody else's to share. So keep it to yourself. So keeping things confidential is really, really important. Integrity. So choosing courage over comfort. So for me, that's really, really important. I think that a lot of choose that comfort zone where we need to start being courageous. Sorry. So doing what's right. All right. Non-judgment is very, very important, especially in our roles in veterinary medicine. Okay. Not just with clients, but also with our peers. We cannot be judgmental of what people choose or what people are in the situations that they're in. So we can talk, but just do it in a non-judgmental way. And then generosity. All right. So extending things in the most generous way that we possibly can. So words are important, but also actions. All right. So what can we do to be as generous as we possibly can? All right. So that means, you know what, if we have been given a lot within our positions, we need to start giving back. So for myself, I feel like I was given an amazing, you know, I went to school and I had amazing teachers. And for me, that was one really big thing that right after I graduated, I wanted to give that knowledge back so much. And so I jumped in and started teaching. I was terrible at teaching right away. So I wanted to continue to learn how to grow and become a better teacher. And I still wanted to continue to learn from there and grow as a teacher and do all of that. So from there, I just continued and give as much as I possibly can. So also how to grow more psychological safety. Okay. So setting the stage. So set expectations for yourself, set expectations for your team, set expectations for your hospital, clarify everything. So needing for your voice. So what do you potentially need? Emphasize your why. So if you don't know what your why is, we'll talk about that. And then invite participation. So demonstrate humility. So meaning we need to know who we are, but also kind of stay level-headed. Ask questions, always model that listening. And then provide guidelines for discussions. So meaning that, hey, when things get high, intensity, emotions get high, we need to set those expectations of how we're going to talk, how we're going to listen. And that's gonna help with your psychological safety and help with your emotions. And then again, expressing that thank you is really, really important. Destigmatizing failure. So if anyone's taken the VTNE or heard people taking the VTNE, this is a great example. People fail the VTNE quite a bit. And I like to talk to people about, you know what, it's okay that you failed. It's a learning experience. We are going to grow from that and we're going to conquer it. You know, I don't want people to feel like that's it, I quit. Like, you only fail when you stop trying. So we need to move forward and look ahead, brainstorm new ideas and grow from it. And so that's how we have to look at things in our hospital setting. So, hey, you tried to place an IV catheter, you didn't get it that time. That's okay. We all have bad days. Let's move on. We'll get it the next time. You know, oh, you couldn't get that jugular stick. That's fine. We'll get it the next time. It's no big deal. All right. Rather than sometimes we have people that say, oh, you couldn't get that. Man, you're terrible at it. You know, being really negative, and that's just not good for the environment, not good for that person. So what is your why, right? So we need to start waking up every single day and going, why am I doing this, right? Not what am I doing, but why am I doing it? Why did you start working in the veterinary profession? Why are you doing exactly what you're doing? You know, so for me, I wake up every day and I'm like, why am I doing exactly what I'm doing right now? And I know exactly what I'm doing it. And why am I doing it? How am I going to get it done? And then what is it that I'm going to do today? And that's how we have to start looking at it. And that's how we're going to be successful. All right. So if anyone's seen Simon Sinek, that's how he describes it. So we have to really start looking at it. If we start looking at the what and then how and then why we're doing it, it seems pretty blah. All right. So think of the why. Think of why you want to do this. Why did you ever start it? So I put this together. It's called the Just Culture. So if you've ever heard of it, but this actually started kind of kicking off when there was a nurse who was in the profession that gave the wrong drug to a patient. And unfortunately, the patient died. And she actually brought it to the attention of the hospital that she gave the wrong drug, and she ended up getting tried for and convicted for, I think it was manslaughter. And it was an honest mistake. There was something wrong with like the Pyxis that she was working with too. She was like training someone at the time. And she just had a lot of things going on. And so it's something that honestly, so many other nurses could have done. So many of us, we could have done too by getting the wrong medication and everything. So they talked about just culture and creating this incident tree. And so again, if something is intended, if we intend to hurt or harm a patient, that's where a big consequence should come in, right? But if we're looking at it and there's not even a protocol in place at your hospital, that's where we kind of need to look and go, hey, look, it's not just that individual's fault here, but we need to look at a systemic issue and say, we need to put a protocol in place. We need to have a training program in place so that we get everyone on track again. And so this was kind of something I put together so that we can actually look at it and say it's a decision tree of like, how do we handle these situations if something happens? So again, not that blaming and shaming anymore when people make mistakes, but how do we handle these things? Because we need to rather say, okay, there was a failure in the system, but let's fix it and make it better for the next time. So our plan for our psychological safety, right? So we're going to grow by agreeing to share our failures. All right. So not hiding them. We are going to recognize those mistakes as opportunities to learn and grow. So say we've made mistakes in the past, we can share those with people and say, look, I gave the wrong drug this one time and now you guys know about it. So you're never going to make that again. Or I forgot to, place the filter when I was giving this drug, and that's going to help that young technician so that they're not going to do that in the future. So it really is a great training tool. Ask for help, all right, and freely give help when asked. Embrace expertise among many different people, okay? You do not have to be a hero, all right? Encourage and express gratitude and reinforce team members that, they have a sense of self. So giving gratitude is super, super important. I think that's a big thing that we miss a lot of times is at least saying 3 great gratitude things a day. It really will help you mentally. I see on social media all the time, people say so many negative things. And it's like, wow, if we could actually just, look at like a few good things that happened today, that would probably turn our mental state around just a little bit, like we hang on, and I do the same thing too, is that we hang on to like maybe that one bad thing when all these amazing things happen to us today, right? That probably happens all the time to you guys. So try to take that one bad thing that happened and throw that to the side and look at some of the good things that actually happened. And listen. So ask powerful, open-ended questions and then actively listen with the intent to understand. So listen, not think of what you're going to respond with, right? So we want to make sure that we're actually listening. Doesn't want to move forward. All right. So does your company or team reward authenticity or reward fitting in? So think of that. Do you guys have cliques at your place that you work with? That's how I usually put it. And it feels more like, they're fitting in culture. Is there something that you want to do to help create a culture of true belonging? So belonging means that you can feel like your natural, normal, authentic self, that no matter what you say or do, that no one's going to be judgmental of you. And how would you do that? Do you guys all feel like you could be your authentic self? I'm picking on someone. Crystal. Oh, oh, sorry, you can't talk. I'll type though. Okay. How about Paige as well? I feel like we encourage authenticity because we have to. Otherwise, most people feel like they have to just fit in and stay under the radar, which is sad. Interesting. Huh. That's an interesting thing. So they're not really authentic, is what you're saying. So, and that seems to be kind of what I have experienced is that we really kind of have that. Correct. Okay. I was like, I think you're giving me this politically correct statement. um, that's kind of what I've experienced in some practices as well, is that you can't be your authentic self. I've also worked at some practices that have been amazing, where you can literally do some of the craziest things in the world, and we've had the best time of our lives. And it's been super, super helpful to get through some crazy stressful times too. So I think that's where we really need to get to, is that, you know what? Like, who cares how sometimes we are? Like, we're all a little weird. Let's be real, right? We all work in veterinary medicine. We're all going to be a little weird. It's okay. And we need to share those stories of how those crazy weird things are. So this is again from Flourish Veterinary Consulting. So again, having the autonomy to be able to do our jobs. All right. So that's a whole other conversation for veterinary technicians, having autonomy to do our jobs, doing them well, right? Having connection with everyone that we work with, right? Connection with our leaders, connection with our doctors, connection with the people that we're working with, connection with the kennel staff that you might have, connection with everyone, right? So it's our job too to make those connections. And then competence, which again has been a huge struggle, especially since the pandemic, because we've had a huge amount of turnover. So this comes again with training and growing and stuff like that. So competence also is training within the hospital level, and then also continuing education, which is again why you guys are here, why you guys should come to the ISVMA conference, and just continuing to grow and get better, networking with people, growing, that type of thing. So as you have all three of these things, so if you guys ever watch Josh Weissman, if he talks about this, he talks about how if you have all three of these things, you end up getting this incredible amount of motivation to continue to grow. If you lose even one of these things, or this perception that you don't have it, you end up starting to demotivize yourself or have demotivation. Okay. So for myself, at one point, I definitely felt like I had no autonomy within my role, and I definitely felt demotivated. I felt like I had connection with some of the people that I worked with. And then I started losing a little bit more connection. But I always felt like I didn't have that autonomy that I felt like I really needed. Um, so now currently within my role, I have all three of these things, and I have incredible motivation to continue to grow, continue to get better. So I totally believe that this is possible, and I believe it's possible within our field. All right. So this is really important for leaders, for us too, that we have to be ready to give feedback when it's appropriate. All right. And so if we start giving feedback to people when we aren't ready to do that, this can also demotivate people. This can also hurt our relationships with people. And so if we're sitting down with people, we need to say, hey, you know what? Like, I need to take 10 minutes, or can we come back to this conversation later? And people need to respect that, and for you to come back later. So when you come back, you have to be ready to be able to sit next to that person rather than across from them. That really helps with conversations. Put the problem in front of you guys rather than in between, right? We don't want to argue about that issue, but let's put it in front of us so we can tackle it together. You're ready to listen, all right, and ask questions, accept everything about that issue. You're ready to acknowledge everything of what that person wants to say rather than, we're going to pick apart everything. We want to recognize people's strengths and how we can use them and address challenges. And we want to hold people accountable, sure, without shaming or blaming. That's really important. And then we want to be able to own our part as well. All right. So that's a very, very strong part. We can own whatever part we maybe messed up to. All right. That helps. We want to thank someone for their efforts without criticizing their failures. And we want to be able to resolve challenges and help with any kind of growth opportunity. And model vulnerability is really, really important. Okay. So being able to be open and see expectations out of that person. So being vulnerable to someone doesn't mean that you have to be super, super open about your entire life and your whole life story, but it means that you're able to share, that you have had maybe a struggle before, that it's okay to make mistakes, or that, we can get through this together, right? That's part of being vulnerable. That you're aware of power dynamics and about biases and stereotypes, right? But that we don't have to put that between the entire team, okay? And everything. So, do you see people in your company modeling belonging and believing in themselves? And what does it look like when people have the courage to speak up and take unpopular stands? All right. So think about that within your hospital or within any place that you've been. Do you think that if you had someone actually speak up and take an unpopular stance, that it would be received well? All right. And if you think that that's something that's not going to be received well, that's where we have to start going, okay, we need to make some changes. All right. So true belonging, I love this. True belonging only happens when we present our authentic, imperfect selves, right? Nobody here is perfect. And that is wonderful to the world. Our sense of belonging can never be greater than our level of self-acceptance. So that means we have to first accept ourselves of who we are, right? That took me a really long time to actually self-accept, I am not going to be ever perfect. So if I don't accept that, nobody else around me is going to accept it. So phrases we should be hearing from our team. I need help. I might be wrong. I have an idea. We have a problem. I messed up. Why don't we try it this way? I made a mistake. I disagree. If we don't hear those things within our team, our hospital, we need to make some changes. All right. That means that your team is probably not feeling quite safe. So that's basically pretty much it that I have. So saying that we are only free when we realize that there's no place of belonging, and no place at all. The price is high. The reward is great. These are my references. So I just wanted to let you guys know that I personally love Lead to Thrive from Josh Weissman. It is a wonderful, wonderful book that is about veterinary culture specifically. I definitely recommend it. You can actually, if you don't like to read, he actually has it as an audio book, so you can read it that way. And then Radical Candor is a really, really great book too, about how we can actually have great conversations with people in our workplace too. So that's kind of two references that I used within my presentation today. And I'll take any questions that you guys have. I left about 10 minutes for you guys, if you have anything.
I don't have any questions, but I just wanted to say that that clinic I used to work at, when you were saying, be grateful and say thank you, and it's little things like that that make a difference.
Yeah.
Our owner, I still remember it. He used to thank us every day. Thanks for being here. And it just meant a lot to a lot of people. that was just something like no one ever did before. And everyone's like, wow, he just thanked us for being here. And it was so simple, but it was so meaningful.
Yeah, yeah, definitely. I worked with someone before, and it was interesting because she was a doctor and I worked in emergency medicine, and she was this crazy doctor that moved like crazy all the time, and she'd make a mess everywhere and she'd get blood everywhere and whatever, and we'd have to clean up all this mess. But you're right, every single day before we left, she would personally be like, "Thank you, Beth, for everything that you've done today," or whatever. And I'd be like, "You're welcome. I'll see you tomorrow." Like it was just really nice to have that appreciation. Even though I think she knew, like she made us run around like crazy. So I think that those little small things really do help. And so somewhere we have just forgotten some of those things, and we need to get back to just that. And so, like I said, this is just one part of that. We have so much more that we need to accomplish within, what our purpose really is, and what our path's going to be and all of that. But if we can start with making our environment safe, then the rest is going to be so much easier. So, anyone else have anything that I wanted to share? Crystal says, agreed. I changed positions, departments, and my new boss now thanks me. It throws me off. Yeah, most definitely. Yeah, and it's crazy because it shouldn't throw you off, because it's just like this simple thing, right? But it's things that we're just not used to. So that's where we now have to like take that and then start dishing it out to other people. So anyone else have anything? Anyone else, can you feel like you can implement anything even tomorrow? You're all going to say thank you. Check in with people maybe, right? And if people make mistakes, or if people can't do something, we just need to support them and say, it's all right. Like, we all have bad days, right? It's not a big deal. So they're just, again, these really little things that we can do, or ask people for their input. Even if you feel like you don't need it, sometimes it just makes people feel like they're really, really important. Right? So just kind of try to help within your area to kind of include people, make them feel good. And also try to get them involved with learning, say, hey, I'm doing this CE coming up. You want to join me? It really gets people encouraged and wanting to grow and be better. Awesome. Anyone else have any other questions? Otherwise, we can wrap it up. Great.
Thank you for a fantastic presentation. I know I feel higher energy than when we started tonight. So thank you so much for all the positivity. Great suggestions on things to say and do to help everyone feel valued and safe in the workplace. Thank each of you ladies for joining us tonight. We really, again, appreciate all that you do. And we have a fantastic CVT committee in this organization. So if you're a member, please reach out if you'd like to be part of that. If you're not a member, please reach out and learn what this group's doing, because they are moving mountains here for the profession and improving it every single day. We thank all of you for all you do. We hope you have a fantastic time. We understand that your time's valuable, and we appreciate that you spent it with us tonight. Have a great night, and we'll see y'all later. Thanks. Bye.
Bye.